I'm going to primarily focus on acne. But androgens, when you think about it, are intricately involved in hair loss and acne. As far as acne goes, androgens play a role in sebum production, so clogged pores promote acne. They play a role in inflammation, because a clogged pore is going to promote inflammation in acne. And they also play a role in keratinocyte hyperkeratinization. So it really deals with all the pathways involved with acne. And that's why using androgens to treat acne is so useful, and it's sort of coming of age. We have a product called testosterone, which was FDA approved a few years ago, topically for men and women, that hormonally treats these processes of acne. And testosterone is stronger than other anti-androgens like spironolactone, which we'll talk about in a second, to block 5-alpha reductase, which is involved in androgen, the production of testosterone. Dihydrotestosterone blocks androgen production. We have spironolactone, and that's really come of age in the last few years. More and more dermatologists are using it not just for hormonal acne, but also for acne on the trunk, anywhere on the face. It's proven useful in the treatment of acne in women, no matter what the acne is, no matter what the age of the person is, not just older women who have hormonal issues, but for younger women as well, like I said, on the trunk as well as the face. There has not been that many studies with spironolactone in acne. There's 2 studies that showed evidence of spironolactone working in acne. One recent study just published 3 weeks ago, which I went over, that showed spironolactone versus doxycycline over a 6-month period combined with benzoyl peroxide. Over the 6 months, spironolactone actually surpassed doxycycline in terms of working on acne, although doxycycline was stopped at the 3-month time frame. But doxycycline is not meant to be used long term. The AD recommends 3 to 4 months of antibiotics only. That's another big advantage of spironolactone, is that you can use it long term in females to help control their acne. And it was recently added to the AAD guidelines of care for acne. Spironolactone is part of the guidelines of care as well. So it's a very useful therapy. And spironolactone actually doesn't just block 5-alpha reductase. Spironolactone works in multiple ways to stop androgen production. It helps block androgen production just like oral contraceptives, which are also used for acne, to block androgen production, and interferes with sex hormone binding globulin. It also stops the production of androstenedione to testosterone and higher up on the pathway, and that helps block acne. So it works in multiple ways, and it's a safe product that's been around for almost 100 years. We use for acne. In terms of hair loss, androgens, we know, play an integral role. And we talked about the process of hair loss developing and how androgens affect hair loss and newer treatments for hair loss besides finasteride that are coming of age and in clinical trials.